right. Back to bleeding. Let's see what you guys learned Thursday night. First of all, do you have any questions? All right, then we'll start. You've been dispatched to a female with a cut arm. What do we do first? Scene size up. Try that again. All right, your BSI is on. Law enforcement's there. Patient is very upset. Mechanism of injury. She was locked out of her house by her mother, so she punched the living room window, breaking the glass and cutting her arm. Probably not the best choice out of any. She's the only patient. You already have law enforcement or Moros Rescue Squad with you, so you got good resources. You're considering spinal mobilization, but you don't really see a need for it. What comes after scene size up? Primary assessment. What's your general impression? What's your level of consciousness? Chief complaint, airway. Are they breathing adequately? Order oxygen. Do they have a pulse? Is there any uncontrolled bleeding? What are the skin signs and is this a priority? So we've got a late 20s, early 30s female. She's upset, significant bleeding. She's alert. Blood's rushing out of her right arm. Airway's clear, breathing adequately. She's got a good radial pulse in her left arm, but she's profusely bleeding from her right arm. And she's pale, cool, and moist skin. Is she a priority? Is she shocky? What's next? Nobody knows what comes next on the assessment algorithm. This isn't primary assessment. No, sample, somebody said it. History. Signs and symptoms, cut arm. OPQRST to drill down on those symptoms. Onset 10 minutes ago, provoke punching a window. Sharp stabbing pain, 8/10 severity. It has been constant. She's allergic to penicillin. She takes Effexor or Paxil and Norco. Has a history of depression and chronic pain. Last meal was an hour ago, and we already know the events leading up to it. Now what comes next? Secondary head to toe. Blood pressure is 120/60. Heart rate is 0.08. Respirations are 16. Her eyes are open. She's oriented person, place, time, and event. And she obeys commands. What's her Glasgow Coma scale? 15. Somebody said 17. Okay. Everything's negative outside of the incision side and a cuticle vein. What should we do for that? Direct pressure. That doesn't work. What do we do? Yes. And we dip our finger in her blood to write TK and the time on her forehead, right? No, we use a marker. Let's do that. You wouldn't be able to read it unless you got really good blood print. EMT Dexter. Any questions? All right. So a 27-year-old male stabbed in the chest. A disagreement over a poker game. As you approach him, you see the knife is impaled in his chest. Before making physical contact, it's most important to do what? I was gonna say, what was that cookie guy? Fought an alligator? Yeah, just pull it out. How'd that work for him? Never pull it out. Follow standard precautions. There you go. There you go. Cheater. Form a general impression. Does that come before standard precautions? No. Ask bystanders what happened. Does that come before standard precautions? No. Call for an ALS ambulance. Does that come before standard precautions? All right. I guess we probably could have finished that up on Thursday night. All right, let's go backwards. Let's go to trauma. This is a long chapter. Huh? 25, trauma overview. Learning about the golden hour. Thoughts of the day.
Any job, no matter small, no matter how large, has challenges and obstacles. There is no perfect job. But those challenges and obstacles cannot be avoided and must have to be met head on, accepted, and overcome. Otherwise, you will not be successful. You, who you are as a person, the quality that you hold yourself to is the largest factor in overcoming any challenge or obstacle. Whether it be on the job or in your personal life after this job. Tools needed to overcome these challenges and obstacles chosen by you personally. The challenge and the obstacle has no say what tools you choose or what happens or how you handle it. Only you have control over that. Only you can make choices on what tools to use, path you're going to take to overcome the challenge or the obstacle. And in the end, whether you are successful or if you're a failure, will be depend on your preparation, your education, and your choices, not the challenge or the obstacle. Any questions? All right. What are we going to learn about? We're going to learn about mechanism of injury. We're going to learn about how energy and trauma affect the body when it hits it. We're going to go through the differences between penetrating and blunt trauma. We're going to know the 5 types of motor vehicle crashes.
We're gonna understand what multi-systems trauma is, and we're gonna learn and understand how the trauma system works. Any questions? All right, kinematics trauma is the study of how energy is applied to and how it physically affects the body. It's how you help determine mechanism of injury so the surgeons know where to go cut on the body. Some definitions. Work is force acting over a distance. Kinetic energy is the measurement of energy of a moving object. Potential energy is when it's not moving, but it has the potential to. Best example of potential energy is a giant boulder sitting on the little peak of the Coyote and Roadrunner, waiting for it to fall when the Roadrunner goes by. That's potential energy. Kinetic energy is when it falls. Any questions? Like this. Best part of EMT class. That. That's potential energy. That's work. All right, you guys get the idea of potential versus work. We watched this all night, but we wouldn't get much done. But it'd be a lot more fun. All right. K rails. Concrete barriers. They're all over the place now, used to divide traffic. So the idea of them is to displace kinematic energy. So You look at a little concrete wall, or now they're also using the cable systems between the freeways, between northbound and southbound, or eastbound and westbound. And you look at like, man, how's that gonna stop a massive truck from going through it? It's just a small concrete wall. What it does is it distributes and displaces the energy. So here's an excellent example of that. So you don't have to know this formula. It's not on any test, but its kinetic energy is half times the mass times the speed of the velocity of the object squared. So 65,000 pound truck traveling 50 miles per hour is 5.5 million pounds of kinetic energy. If it hits you as a human, you'll probably be killed. 5.5 million pounds of kinetic energy. But how's a little concrete wall going to stop that? It places the energy down the wall. Why? It's the same thing that a seatbelt does, which we're going to go over here in a little bit. So blunt trauma is going to have force applied to the body. Doesn't penetrate the skin. Penetrating trauma penetrates the skin. Any questions about the difference between blunt and penetrating trauma? Which one's more survivable? No. Penetrating. So blunt trauma, just like that K-rail, the amount of force gets distributed over more cells. It does more damage. Whereas in penetrating trauma, it generally focused to the area of the penetration. So it's much easier to surgically repair. So again, mechanism of injury is how you discover where you suspect energy introduced and damaged the body. Any questions? So where mechanism injury is critically important is in vehicular crashes. So you have to understand the types of energy distribution by the types of crashes. And where the patient was sitting, and where the impacts were and how much intrusion there was into the vehicle. So one of the test questions you guys are going to face a lot is what's called the 3 collisions. So in every car accident, there's 3 collisions. There's a collision when the car strikes an object, either another car, a tree, a wall, whatever. And then you, as a human, traveling at the same speed as that car, which most people don't seem to grasp or comprehend, then strike the inside interior of the vehicle at the speed you're traveling. And then the organs inside your body crash into your skeletal structure at the same speed that the car was traveling. And those are the 3 collisions. That's why seatbelts and airbags are so important. Because what seatbelts do is it's a webbing structure. And what it does is like that K-rail we just watched the video, is it absorbs energy and it gives you what's called ride down time. And what that ride down time is to give ride down for the 3rd collision of your organs inside your body smashing against the skeletal structure. So instead of it, if you're doing 60 miles an hour and you hit a tree, what that does is it gives you the ride down time to not have your heart, lungs, and brain smash against the skeletal walls at 60 miles an hour. And it absorbs that energy through the belt. Matter of fact, when you guys start going out there, you'll see CHP almost always when they get to a wreck. After you've gotten the person out, first thing they check is the seatbelt. They check for the elasticity, because if the belt seatbelt was on and the ride down time was done, it becomes loopy and sloppy. Same thing if you're buying a used car. If your seatbelt's loopy and sloppy, that means that car was wrecked and someone was wearing a seatbelt. Because body shops almost always, unless you tell them to, don't replace the seatbelt. Any questions? Any questions about the 3 collisions?
No questions, huh? I explained it that well. So you got 5 types of motor vehicle collisions: frontal, lateral, rear end, rollover, spins. All 5 of these have different ways they transmit energy. So frontal collisions gives you a frontal impact, so all the energy is coming forward at you. Like these.
Coming to turn one, and don't forget, he had just stopped. Watch this car move right here. Something breaks on that car. You can clear the traffic. Oh. And huge contact with the Armco, and watch as Jimmy climbed out of the car, and the damn guy not
So I was
okay.
able to do that over 100 miles an hour. Well, firstly, got ride down time for the impact of the barrier. Plus, he was wearing a 5-point restraint harness. So you have 5 different belts giving ride down time, which is why he was able to do that. Without that, he would have had major frontal third collision injuries. It is a great drawing of the of a frontal collision. Car hits a tree, he goes forward, knee hits the dashboard, blows her proximal femur right out of the pelvis, also known as a hip fracture dislocation. Set mechanism injury, tell you something you really need, it's really important there. Didn't breathe. Seat size up, what are you looking at? There's kids in that car. It's all kids stuff. Like baseball. Always wasn't out of the way, I'm following. Okay. Bitch, knew it was coming. Knew it was coming. Damn it. Any questions about frontal collisions?
Yes. I'm just curious, a lot of those like were pretty straight on, but they're not considered frontal because they hit one side a little more than the other.
Well, then they'd be, so if it hits on the side, that's a lateral. But the majority of those were actually frontal. Oh,
Okay.
frontal for one car, lateral for another.
Yes, okay, that's what I was thinking. So
I got some good lateral ones for you too.
Okay.
Just hold on. Here's some more frontals though.
Yes. What?
Run, row. That was almost a rollover too. Chase is over. Whoa. It's a rollover. Good ball machine. May have been going too fast. Raymond did not stop the crash.
Alright, you guys get the idea. And now let's look at some rear end collisions. So rear end collisions, you get a lot of whiplash, back injuries, coup contra coup, which is when the frame goes back and forth in your head like a paddle ball.
Hey, Brad.
Yeah.
So any collision. Someone's coming head on, and they hit someone sideways, this person would be.
Lateral.
Lateral, and this person will be head on.
Correct. We already saw this one. This is a head on and a rear end collision, almost lateral. And very fatal. Any questions on rear end collisions? Not wearing a seatbelt, you get knocked forward. So lateral collisions have some of the highest fatality rates. Your arteries and vessels and tendons do not go well sideways from lateral impacts. Like this one right here is a definite fatal.
And then out of nowhere. Oh,
Not coming back. So not all of these are laterals, but it's hard to get good lateral collisions on video, but it's the closest I can do. Well, that's what happens when you let cats drive. It's the center function. Lateral. There's a lateral for you. Those don't go well. Lateral. Called motorcycle bullet. There's the lateral. No.
Does the car have to do a full?
No, it's just rollover under it's free. I got some good rollovers for right here. So rollovers got a different injury patterns, more like if you're not restrained, you're more like a lottery ball or a bingo ball. And generally, if you're unrestrained, you'll probably get ejected. And the other problem with being ejected is generally you're traveling the same trajectory the car is. So when you land, then the car lands on top of you. So ejection rollovers are bad. They're unrestrained rollovers, they're really bad. Well, keep grandstands in America. Yeah. So. Again, you get ejected once first, so you're already traveling at the speed of the vehicle. And you get ejected, so you're traveling, so you're doing 60 miles an hour. You're now flying through the air, you're going to strike an object at 60 miles an hour. And a lot of times when you're getting ejected, you're getting catapulted, so it's actually increasing your velocity. And then when you land, the vehicle will generally land on top of you.
News of a police chase on I-27.
This one's a good one.
To Sean Conroy, who's live.
It's over 100 miles an hour, clears a 4-lane highway, gets ejected.
For shooting, what can you tell us?
Yeah,
And it lands on his head.
Best we can tell, he's heading now, definitely tell he's heading.
Last car he ever
eastbound
stole.
at a very fast clip. That white Suburban was following several police officers in chase, basically coming near Frontenac where this all began, near Lindbergh on eastbound 40. About 100 miles an hour, we're told right now, this white Suburban is flying on eastbound 40. And this all apparently happened on Bob Road, Frontenac, with a shooting. This
There he
kid,
goes.
went out west, up off the road.
He gets ejected and boom, right on his head.
Ejected from the car. Horrible crash. That is about,
That is a classic mechanism of injury for ejection.
Sean, this unbelievable video. This is amazing. What can you tell us as
It's
far as the
amazing.
police officers, how many are on the highway, how many are chasing this vehicle?
we didn't see too many, Sandy. I look back, probably 4 or 5 right now, but many more. Obviously, were involved as this passed up throughout West County. This was headed all the way up to page 270.
Get a good Samaritan run over to help and go, oh, yeah, not much we can do there.
Just east of Lindbergh.
Any idea why this individual was fleeing in the first place?
I'm sorry, Alan, what was that?
Any idea why this person was speeding in the first place, was fleeing in the first place?
We understand he's shooting in Frontenac, leaving on Bach Road from what we understand now. You can see the first police officers arriving. I need to correct something. They were not that close to this suspect. They had backed off, but he was still charging at quite a clip, as we said. We estimated about 100 miles an hour at one point. The police officers have arrived. That person, as you saw, is ejected, is laying there on the side.
And Sean, these kinds of situations are always so dangerous.
Now, you don't always have the vehicle on top of you, because the vehicle hits the K rail, it won't land on top of you. But if you landed on top of traffic.
Go on.
Slow motion for those of you that didn't see it. See, if the K rail hadn't been there, the car would have rolled over on top.
Didn't realize they were speaking up so free.
This may be disturbing and graphic. This is quite the chase. We'll watch what happens when she gets ejected. It's very disturbing and graphic, huh? I'm pretty sure, yeah. And she actually does a really good job of evading the police until she makes a mistake. Oh yeah, no, she did damn good. The problem is when you're driving like this, there's no margin for error, and eventually you're going to make an error. Tries to pit her. Successful pit, but not successful enough. Hits her again. She gets away again. Very impressive. Again, though, it's only a matter of time until your number comes up. Yeah. But she got away with like 3 or 4 pits. And there's like four police cars chasing her. She's evading all of them. Through drainages. The same trailer park again, almost rolled it there. So there's no kids in the backyard playing. Escaped another pit. Escaped a roadblock. This is where it gets ugly. It's. This time, she didn't escape it. Yeah, not good. Rolled right over her. Mason looked it up, she's still alive. Look how fast EMS works there. She candidate for full spinal conference?
Yeah.
Oh, here's another one. Oh, this one's bad. Whoa. Right there. And right there. Yeah, multiple ejects. It's like, what happened? There's still one in there that didn't get ejected. This one's impressive. Lateral impact. Cuts the car in half, lateral impact. She lived to race again. This one, was fatal. Right over them. They moved the car over so another car can run over. Instead of just blocking the roadway. All right, so now you know rollovers and ejections. Now how about spins? Any questions on rollovers and ejections? Don't want to be ejected. Spins. Spins put an impressive rotational force. And wreck the Jeep, that's sacrilegious. All right, vehicles versus pedestrians. This is a significant mechanism of injury. So you want to know speed of the vehicle, how far they were thrown. Did they get knocked up and over the car, or do they get knocked, propelled away from the car? Or sometimes they get propelled away from them, then get hit by a car and oncoming traffic sometimes too. Any questions? One interesting thing, adults, if they know they're about to get hit by a car, they turn away, so usually the impact comes from behind, whereas in children turn towards it. And we don't know why that is, but it's very common. Huh?
Curiosity.
Maybe.
They don't know shit happened.
Here's some vehicle versus pedestrians for you.
And if you want something to happen to you,
I don't know why you'd be running on a racetrack, but people do it. Watch this guy's shoe. Goes up over the walkway. Another guy running on a racetrack. Oh, I don't understand. Smart enough to get up and run out of truck, no, they go lie down in Sanford. This guy, this is the Darwin, that game. So this is a good example of why your EVOC course is important for an emergency vehicle. Because this cop is a master at operating an emergency vehicle. Watch, he drops the knife. I'm done. Don't do that again. So this one just happened a few months ago. This happened on YouTube Live. They were actually videoing it, so I grabbed it real quick because I knew YouTube would take it down literally as soon as they found out. So I actually saved it to the cloud, on my own cloud. Because you don't see this every day. So this is not for the light of heart. Yeah, this just happened a couple months ago. Like right around end of December,
I was thinking about the one tab. Now, as we head through Lincoln Heights, it was take us toward Highland Park. South Pasadena, and of course it ends in Pasadena proper.
I was like, I better say this.
And Mike, you've been monitoring this for a while now. This has been going on for quite a bit.
No, so this
No.
is actually the second of 2 cases.
Oh.
So the one we originally launched on, yeah, the reason Deb was up and we got over this so quickly is because the one we originally launched on was a CHP pursuit out of the city of San Bernardino. That came
So
through
two
Orange County,
pursuits.
right? So the CHP actually lost that one in South LA. And while we were in South LA, new division officers
This is
began
bad.
following this. And as soon as it turned into a pursuit, we pulled the trigger and moved Desmond. So we were over this probably within 3-4 minutes of it starting. So this is actually kind of fresh, but covered a decent amount of ground. This started south of downtown LA, almost in the Vernon area, just kind of on the city line of Vernon, in the city of LA. And then it'll come up all the way through the east side of downtown, through Chinatown, past Dodger Stadium, past the 5. Now we're coming up into like the Highland Park, Montecito Heights area. So, what happened?
Getting out.
Bad choice.
Whoa, whoa, whoa. Oh my God, oh no, stay wide, you got hit.
Still alive.
Almost instantaneous.
Stay wide, you got hit.
We're gonna keep our mic.
Whoa, whoa, whoa. Oh my God, no. Stay wide, you got hit.
We're gonna keep our mic.
As I said, there's no way they're gonna allow this to stay on YouTube. So I clipped it immediately.
It's very narrow and you just have that video really dividing the 2 sides. And as soon as, if the target.
Yeah, that's Queen Mary in the background.
And if he immediately got out of the window, not what?
Queen Mary. I think they do CPR on it too.
All right, well, that's him up there, show it, he's down on the ground. They're gonna
Yeah.
check on him to see his condition.
There's no way. And it takes a long time for fire to get there, an ambulance.
Driver decided to jump out with the car moving, the van moving, stolen van, and he just
Yep.
couldn't get out the door, so he climbed out the window, landed on the center divider, and then fell into the lane. That's when the car from south down in one fence struck him, not one, but 2 cars struck him. And now he's down in a flow lane there. And now the LA City Fire will be responding, paramedics here.
That's all I have.
Boy, no, there's no gutter lane in that center divider either way, freeway, so. I don't know if the driver didn't know that, but he landed on that. Off the center divider and.
Put your gloves on, start CPR. There he goes.
Fell over in the lane.
You should not wait that long to start CPR. I think you had to wait for gloves. Someone brought him gloves. He didn't have PSI seat safe.
Center divider and he fell over.
It was a while, because traffic's blocked both sides, so ambulance and fire had trouble getting in. There they come. Any questions on vehicles versus pedestrians? Don't jump over a carryall and oncoming traffic. Yes, and one. Falls. Question?
There to do that which pedestrian versus cars is not survivable. Is there definitive speeding?
No,
Okay,
not that I'm aware of.
gotcha.
Anything over 5 miles per hour is considered a strong alert though. Which we're gonna go over what a strong alert is here for a second. Falls. So things with falls is you wanna know the height of the fall, free fall, the surface they landed on. And what body part landed first. I have seen people fall over 100 feet, walk away with it, no harm.
The guy jumped off a bridge in Dunsmere, the highest bridges in Dunsmere. Huh?
Was he drunk?
No, he was sober. He was running away from a boys' home. He thought that, he was on the 800-foot bridge. And he saw the tops of the oak trees. He thought it was bushes, so he thought he'd run over as the nighttime, jump over and hide in the bushes. Then when he jumped, he realized it was the top of the oak trees. But he was lucky because it was wintertime, Caltrans pushes all the snow off there. So there was like 20 feet of snow at the bottom. So he fell like 100 feet and then landed in the snow. So down there, got him up. He's 15, just walked away from him. But generally, it doesn't work out that well. Things like this end really badly. That's why you should have railings for trapdoors. For this exact reason. Yeah. That hurt. So do all of these.
當時已經被投訴嘅美團有球迷用腳踢人落看台。
Oh, close. Belly flop.
You thought the guy in the car was an idiot. Check this guy out.
Belly flop, belly flop. And have him down. Oh my God. Yeah.
On a fence on top of a hillside.
Oh. Oh. Oh my God. Oh my God. Dang. That was a stupid idea. You all right, man? Let me come from the outside. Brett, look at me. Try to fuck your nose again, that's great. Do you have any bait?
No, it's splits all over the place.
That was awesome though. Take a picture. I'm recording it.
This is about tip load weight.
Ocurrió en la frontera entre España y Francia. Dos bomberos rodaron 70 metros al soltarse de un cable de un helicóptero cuando simulaban un rescate en una montaña. Sus cuerpos, como estamos viendo, golpearon en contra de las rocas y ambos sufrieron múltiples fracturas. Uno de ellos incluso sufrió contusiones en el cerebro, pero sorprendentemente los dos sobrevivieron.救助の最中、アトラクションが再び動き出し、乗客と救助隊員の2人が地面に投げ出されたのです。この2人は重傷だということです。
There's a decapitation here. Probably be too fast for you to see on the initial one, but I'll slow it down and circle it for you. Here it is for slow motion for those of you that missed it. I think that's the end. Yep. Any questions about falls? Generally, the next thing that happens after a fall is winter. Any questions? Oh. I want to have a beer with these guys. Sorry, wrong one. These guys are great. Hey, what happens is The way they handle it is just great.
You know, you try?
Look at the penalty for failure, dude.
Penalty for failure, deal.
That's a hell of a job, Miles. Ah, shit, that's a hell of a fucking thing. Oh, there was a little thing. Be careful, that's a hell of a, oh, shit.
Oh my.
Oh, no. Oh, shit. Oh, you all right? Did you kill it?
Yeah.
No, hey.
Hey, just sit down, sit down, sit down, sit down.
There, Miles, until you know everything's connected.
Sit down.
The commentary is going down.
You gotta watch this go twice, just for the commentary.
I know where I'm going. Oh, you know, you try?
Look at the penalty for failure, dude.
That's a hell of a job, Miles. Ah, shit, that's a hell of a fucking job. Oh, there was a little thing. Be careful, that's a hell of a, oh, shit.
Oh my.
Oh, hell. Oh, shit. Oh, you all right? Did you feel it?
Yeah.
Hey.
Hey, just sit down, sit down, sit down, sit down.
There, Miles, until you know everything's connected.
Sit down.
Oh, God. All right, penetrating trauma, second largest cause of death in the United States after blunt trauma. Blunt trauma, first number one killer. It's really hard to survive blunt trauma. Penetration can be low energy, medium, or high velocity. And of course, the higher the velocity and the larger the object, and the greater the penetration, the more traumatic the injuries. Any questions? COSEMT class, how can I help you? Okay. Okay.
Photograph and document all of it, please. Okay. Well, you should see it. So. Okay. All right. Okay, thank you. Bye.
All right. Second largest cause of death because of, again, we already went through that. Any questions? So this is another ones that I clicked because I knew YouTube would immediately pull them. This was 5 years ago. One of these things, so what this video goes over though, that's really important is about distracting injuries. So you have to always do a complete assessment and not let one type of energy distract you. So this is a gunshot wound to the pelvis, which is as bad as it gets. Getting shot in the pelvis is really bad because it's so vascular. And when he fell after getting shot in the pelvis, he cracked his head open. And they're all trying, of course, they're not trained medics, they're self-declared medics in Iraq. And they're trying to treat his head injury while he's bleeding out of his pelvis. And he died. So I was like, oh, I better clip this before it's gone. Sure enough, you cannot get this on YouTube now. Actually, this is not what I was thinking it is. This is one where two people get shot. One guy blows his arm off. One takes a shot to the chest, the other one pulls a gun and gets shot. And it shows the impact to his arm.
Nobody puts a tourniquet on. That needs a tourniquet. Pretty funny that he was wearing a hat that says medic and he's screaming medic. Kind of ironic.
Right there, we're coming up to you. We're coming up to you.
So again, if you're watching live streamers and something like that happens, if you don't clip it, it'll be gone in a few hours. And this is the one where the guy shot the pelvis. And they're trying to treat the cut on his head. Take their shirt off and they're trying to dress his head instead of his pelvis. Pressure on his head, he's been shot in the pelvis. Any questions about gunshot wounds? So low energy penetrating stabbings, things like stabbings, falling on impaled objects, stingrays. Any questions? So generally with gunshot wounds, the entrance wound is going to be small. The exit wound is usually large. There's not always an exit wound though. Like for instance, this is a guy who was trying to stop someone from shooting. That's the exit wound. Entrance wound's in the palm. That's the exit wound coming out the back of his hand. This is also a good scene safety one.
Yeah.
This officer's by himself and trying to control a scene after a gunshot.
Yeah.
Just because law enforcement's there doesn't mean the scene is safe.
Are doing favor, take any day parts from? Take any day parts. Okay, go back down for weapons, okay? You got anything to folks, they come hurt me? Okay, relax, woman, relax. Relax. Why are you shaking for it? Relax. Oh, okay, shot fire, shot fire. Get back! Get back! Get back! Get back! Get back, sir! Sir, get back! Get back! I'm sorry, get back! Get back, sir! 502, step it up! Get back! Get back, sir! Sir, get back! He has a gun! Get back and I will!
Still cars driving through.
Get back! Get back! Get back! I will be sorry, man. Suspect is shot. He's got a gun.
Any questions? So a few of these things, these are not on test. Objects at rest will stay at rest. Objects in motion will stay in motion until some force gives it resistance to stop them. Force equals mass times acceleration. And what's the third law? For every action, there's an equal and opposite reaction. So head injuries, you can have bleeding inside the brain, tearing of the brain, skull fractures. Neck, one of the biggest thing on the neck is you have open wound in the neck. You have to watch out for air embolus. There will be lots of test questions on that. Open neck wounds, occlusive dressings, trying to stop air embolisms. Any questions? You also have to watch for bruising that can obstruct the trachea, if the collapse of the trachea from blunt trauma, and of course, spinal precautions. We're going to go over each one of these in their own chapters too. Injuries to the chest. You can get broken ribs. You can also get tearing of your great vessels. Your great vessels are your vena cavas, pulmonary artery, pulmonary vein, and the aorta. We're going to go over pneumothoraxes in detail when we do chest injuries. Layman's term for a pneumothorax is a collapsed lung. Any questions? Abdominal injuries. Again, blunt and penetrating trauma can rupture organs. Solid organs you can bleed to death from when they rupture. Hollow organs generally don't cause you to bleed to death, but they leak digestive fluids and lots of bacteria, so you get peritonitis and die of septic shock. Any questions? Multi-systems trauma. Don't try this at home.
No, they in the pickup, you that.
Probably sounded like a good idea when I thought of it. I saw this. Ugh. Any questions? So this is actually a really good video. So the golden hour, so we know that if people can survive past the first 5 minutes, they generally nobody dies between 5 minutes and 1 hour. So if you can get them into surgery within 1 hour of the time of their traumatic incident, they have a good chance for survival. If you screw around doing all kinds of cool EMT and paramedic stuff, starting IVs, waiting for cool stuff, and not doing the things, the only thing that matters is getting them into surgery in less than an hour. And at the end, the surgeon basically says that, basically, if things would be different if they could have gotten this patient there sooner, but they wasted way too much time in the field. But this is a great video.
The surveillance becomes priority one. This classification means a life or death emergency. Trying to convince an arms length surrender. This was valid sanity by a domestic dispute. Police enter her home. She was shot 3 times. Because of her active work and rates of breathing, my paramedic chief will know that she's on the line between life and death. Her pulse returns, and she might have a chance. Smith, a ground paramedic, joins the medevac crew for the flight to Shot Plum. It's going to take 2 people to keep her alive. The second her heart stops, they must start chest compression. If this woman has any chance at all, she's going to the right place. Baltimore's R. Adams College Shot Plum Center, where the golden hour of emergency medicine began. And she's there in less than 20 minutes.
The shot in the torso, or shot through her abdomen. We know that she has essentially no blood pressure. That means that she's bleeding to death. The only opportunity we have to save her is to stop her blood loss immediately. We'll take her directly to the operating room and take out that shot.
I didn't catch it. They start to lose her in the elevator. Cheeseman injects epinephrine into the tube in her neck, the fastest way to accelerate her heart rate. That's one under the game.
Now we have time for anything. All we have time to do is take correct to save their life, and that's what we'll do. But sometimes you just go along, and that's what's going to happen here. You open your book and you start taking care of injuries in order of the likelihood and rapidity with which they kill it. So at the beginning, the issues are at least stop the bleeding, at least temporarily, and find all the best. Technical was in the hospital and an incision on her chest and her abdomen, about 3 minutes.
If we want them, are related than just the level of the liver. So the issue now becomes trying to address the city of things that are, you know. None of us have the luxury of, almost, it takes too much time and it distracts me. I'm very calm, I'm very focused. I've done this a lot of times and it's about identifying blood. There are a number of maneuvers that all of us use to get at the areas to expose the blood vessels. And it's just a matter of moving with the greatest speed to all places you have to look. Some things that are easy to see, you open them right in front of you, like the level of the liver. And there's some things which are very difficult to see because you gotta move stuff out of the way in order to get to. Hands from all sides pack laparoscopy towels into her chest cavity, soak up blood, put pressure on the bleeding sites. The towels hold the intestines aside to reveal her wounds. At some point, her heart stopped beating. Now we have several choices. We can just quit. Well, we know that in a very small number of people, we can revive them and, in fact, still save her life. That is the process of uncoupling life. And it takes place in each organ, and the organs are all connected. Think of it really as a chain reaction. When the heart fails, the kidneys don't get enough blood, and they begin to fail, the liver begins to fail, the lungs begin to fail, and all those put undue stress on the heart, and the heart begins to fail worse. And so it cycles in a direction that ultimately ends up with people dying. We got the lost of her liver out, we got her portal vein ligated and fixed, and I think had controlled all of her blood loss. At some point, you look and you say, this just isn't gonna happen today. And when you realize it's just not gonna happen today, then you stop. And this, I think, is honest assurance as it gets, because we fixed our injuries, but you didn't get here early enough for us to be able to save her life. A terrible, terrible set of injuries, but we had her, we could have just gotten her heart to jump start, but we know what the survival is of people that have cardiac arrest in the field. And it's a very, very, very low number.
Any questions? All those things that they did in the field didn't matter if you don't get her to the surgeon in time. All right, blast injuries. Remember Lebanon? Ammonium nitrate. City, Texas, Oklahoma City. So your primary blast is going to give you direct energy from the pressure wave. Then you get secondary blast, that's the debris. Any questions? And that brings us to the trauma system. So we talked about how the trauma system started in the Korean War. They started figuring out the golden hour. You can live past 5 minutes. You can live to an hour if you can make it to surgery. And they even got better at that in the Vietnam War. And then they figured out that people were coming home, had a better chance of being shot in Vietnam or Korea than they did surviving a car accident in the United States. So they started incorporating the same thing. But it's not as easy as it sounds. You have to have a trauma team ready to go, literally from the time that they know, because you only got 1 hour. So unless you have a trauma team in the hospital 24/7, which most hospitals do not, you have to be able to get a trauma team together, notice that the problem exists, notify the trauma team and get them in there and get them into surgery in an hour. So a trauma team consists of a trauma surgeon, an anesthesiologist, surgical tech, surgical nurses, x-ray, CAT scan, respiratory, pharmacy. It's a crew of about 15 to 18 people. You have to get in the same spot at the same time, ready to do surgery and get the patient into those people within 1 hour of the time of the injury. That's taller, not as easy as it sounds.
Would our closest be assaulted?
What's that?
Would our closest be assaulted?
There's actually 2 trauma centers in Siskiyou County. There's a level 4 in Wairika and a level 3 in Mount Shasta. But we're going to go over the different levels and how the trauma system works. So in order for that to work, you had to put together trauma centers and a trauma system because, for instance, Asante, no one's getting to Asante from Siskiyou County in an hour. So they're dead. So there's no point in that. So you have to have trauma centers set up strategical places and only one per area so that they're the best at what they do and all the trauma patients go to that one area so that they're the most proficient. So it starts with compensated shock. Remember, we got compensated shock, which then goes to decompensated shock, then to irreversible shock. So the compensated shock, if you can live past the first 5 minutes, you can make it about an hour. And then shunts, the way it does that is by shunting blood away from the least important organs to the most important organs. And in a regular healthy adult, it buys you about an hour. If you're not a healthy adult, you may not have an hour. So that's where they got the golden hour from. Everybody knows about the golden hour. Most people don't have any idea what it means. That's what it means. It means that if you can live past 5 minutes and get into surgery within 1 hour, you got a chance. After 1 hour, you generally start heading into decompensated shock. And if you're in decompensated shock for too long, you'll end up in irreversible shock. So some common misconceptions about the golden hour. It begins at the time you're dispatched. That's wrong. Or it begins when you arrive on scene. That's also wrong. It begins at the time of the actual injury. And then the golden hour ends when they cut the skin. It doesn't end when you get to the hospital. It doesn't end when the trauma team starts assessing the patient. It ends when they get them into surgery. So that is not easy to do. So they had to put trauma centers together. So it's literally impossible cost-wise. The cost is enormous to have a full surgery team in an ER 24 hours a day, 7 days a week. So what they do is your university hospitals are generally your level 1 trauma centers. So what they do is they use medical students, residents, and interns, and they put them in the ER with an old guy like me on call. That's usually right there with them. And so that's how you have level 1 trauma centers. So they've got residents and interns that are in the ER 24 hours a day, 7 days a week, full trauma team, ready to cut at all times. Any questions? Now, even those places, they're not sitting around playing pinochle waiting for a trauma patient. They are literally busy 24 hours a day in a state of triage. Where they put these university hospitals in the worst sections of the biggest cities. Because that's where the trauma is, and that's where the students get to learn. The current show about it right now is called PIT. You have a chance to watch it. It's excellent. It's highly accurate. Highly accurate. That's a level 1 trauma center in Pittsburgh. Its predecessor was ER. That's what the level 1 trauma center in Cook County. Questions? All right. Any questions about a level 1 trauma center? Level 1 trauma center has a team in the ER ready to go 24/7.
and has all phases of definitive care. In other words, they've got neurosurgeons, cardiac surgeons, vascular surgeons, they've got everything. All right. Every one of the level 1 trauma centers in this nation are university hospitals or teaching hospitals. There's no way you could afford to do it. So those are only in the biggest cities in the worst neighborhoods. The closest one to here is UC Davis, which is on Stockton Boulevard in Sacramento. Do not park your car there. Ever. The next one after that is Mission Emergency in San Francisco, now called Zuckerberg, because some guy named Zuckerberg gave a lot of money to him. And then the next level 1 after that is Stanford, which is down on the peninsula. Next level 1 going north is in Portland. Yeah. Which is the only level 1 in all of Oregon. So, if you don't have a level 1, you got to go to a level 2. So a level 2 has the same capabilities as level 1, but the surgery, the on-call team is not always in the hospital, but from the time of activation, they can be in the hospital in 20 minutes, which means when they're on call, generally the hospital's given them stipends to have an apartment or someplace close by so that they're at home and they can be there in 20 minutes. That's your surgical nurses, your nurse anesthetist, your anesthesiologist, your pharmacist, your respiratory therapist, your CAT scan people, all those people. Any questions? So there may not be in the ER, but if the time that you call and tell them that you got someone meeting trauma criteria, they can assemble it in 20 minutes. Any questions? And they're still supposed to have all phases of definitive care. Any questions on the difference between a level 1 and a level 2? All right, so level 2s are in most reasonably big areas, like around here, Medford Asante is a level 2, Redding's got Mercy Redding's a level 2, Enloe Hospital in Chico's a level 2. So if you're too far away from a level 2, hopefully you can put together a level 3. Level 3 trauma centers, you can put together a surgeon and a surgery team in 20 minutes, but they may not have all phases of definitive care. So what does that mean? So that means they can have a trauma surgeon there that'll stop you from bleeding to death, that when you get in there, they can stop you from bleeding. But they may not have like neurosurgery, cardiology, or something like that. They'll probably have to transfer you to a level 2 or level 1 if you need more specialized definitive care. They can at least stop you from bleeding this. Like the example of Asante, you'd never make it there. So you go to where the level 3 is or the level 4, stop the bleeding, and then transfer them to the next one. Any questions on the difference between a level 2 and a level 3? Then the last one is the level 4. So the level 4 is same as level 3, but they may not be able to put it together in 20 minutes, or they may not be able to do it 7 days a week. So they can't guarantee it, but it's at least have a chance. Any questions? All right. Those are your 4 levels of trauma centers. There will be test questions on that. You need to know the difference. So when you activate a trauma team, which EMTs and paramedics can do from the field, you can notify the ER that the patient meets trauma criteria. It's a big deal when the trauma center does that. The surgeons stop the surgeries they're in, and that patient has to wait. CAT scan gets cleared out, respiratory therapy gets cleared out. Everybody stops what they're doing, and they all meet in the ER to take your patient. So you can't call it because you think it's bad. You have to use the absolute criteria that is factually, physically there. You can't do it because they look bad or you think they're hurt bad. It has to be based on physiological facts. Any questions? All right. All trauma centers, including level 1s, need time to assemble. Again, the level 1s, they're in a constant state of triage. The earlier you notify them that you have a trauma patient coming in that meets criteria, the sooner they can assemble the team and get everybody together and dedicate themselves to that patient. Even though they're already in the house, most of them have a backlog
of a dozen to 20 patients they're treating. So those patients have to be put on hold so they can come dedicate themselves to the trauma patient and stop them from bleeding to death. Any questions? If it's a level 2, a level 3, or level 4, the sooner you get notify them, the sooner they can get a team together and get those people into the hospital. The goal is to have that team there waiting for you when you arrive. Any questions? So you can't activate the trauma system if you don't know your Glasgow Coma Scale. Any questions on the Glasgow Coma Scale? So when to activate a trauma team, there's 2 different criteria. There's red box and there's yellow box. So your red box, they're under 65 years old, their Glasgow Coma Scale is 13 or less. That's criteria to activate a trauma team if they're a trauma patient. If they're over 65 and they have a Glasgow under 15, especially if they've had evidence of a head stroke. Any patient with a respiratory rate under 10 or over 30 or 30 and above, or in severe respiratory distress with a saturation below 90%. Anyone over the age of 65 with a systolic blood pressure less than 100, or 10 to 64 years old with a blood pressure below 90. Any questions? Any of those are red box trauma. Those are the most serious. 90% of those people will not survive without surgical intervention at some point. Red box is serious.
Do they have to have all of them?
No,
or
any one of them.
Any one.
Any one of those. They only need one. Any questions? So they don't be red box trauma. That's a good thing. That's a real good thing. Oh, we're not done yet. Sorry. Then you have the anatomical. Anyone that's had a penetrating injury proximal to the elbows or knees. Any penetrating trauma proximal to the elbows or knees is a red box trauma. Any skull deformity or open skull fracture. Any paralysis of any limb, especially with suspected spinal injury. Any chest wall instability. Pelvis is broken. So you've got 4 proximal long bones. Your proximal long bones are your humeruses and your femurs. If you've broken half of them or more, that's a red box trauma. 2 of your 4 proximal long bones. Any crushed, degloved, mangled, or pulseless extremity. That's a red box trauma. Any amputation proximal to the wrist or ankle. Or any bleeding that you cannot stop in the field is a red box trauma. All makes sense, doesn't it? They're all things that you probably would want to have a surgery team ready for you when you get to the ER. So they don't be red box. You take a breath. That's a good thing. Any questions on red box traumas? Only need one of these. So then you go down to yellow box. Yellow box means that it's serious, but they're probably not going to die in an hour. And that's any partial or complete ejection from a high-risk auto crash that doesn't meet red box. Any significant intrusion 12 inches at where the person was sitting or 18 inches anywhere. Or if you had to use jaws of life to get them out. Death in the same passenger compartment. This is a common misunderstanding in EMS. The person has to stay in the vehicle. Ejections don't count. If you had your seatbelt on and rolled over and the person next to you didn't have a seatbelt on, got ejected, killed, that's not death in the same passenger compartment. It has to be someone that received the same kinematic energy that you did and died. And that is the number 1 yellow box trauma that dies. Is death in another the same passenger compartment. 0 to 9 years old and not secured in a safety seat. if the car tells you that they are. Believe it or not, there is car crash detectors now that can indicate severe injury data. Anyone that gets ejected from a motorcycle, ATV, horse, goat, etc. Or bicycle, or pedestrian, thrown or run over. And any fall over 10 feet. All ages, or 3 times their height. That's a vertical free fall. Any questions so far? That's the what they call the mechanism of injury part of yellow box. And there's an age comorbid or special circumstance. And that's low level falls. Anyone over the age of 65 that struck their head and is on blood thinners. Anytime you think there's child abuse. They're over 20 weeks gestation of pregnancy. Or any burns with other polytraumatic injuries, meaning multiple traumatic injuries. Any questions? So if you have someone that meets those, that you can absolutely say meets those, you can call the closest trauma center and say, I have a red box trauma, give them the qualifier, or I have a yellow box trauma, give them a qualifier. You can't just say it's trauma alert because you think it looks bad. You have to have physical evidence. Yes.
So for the 10 fall.
Yes.
It doesn't matter if he's not complaining of anything, it's just.
Yeah. Now, if it's a yellow box trauma, they fell 10 feet and they have no complaint, you still notify them. They're probably not going to call in a trauma team. They're probably going to call and notify the trauma team, and then the ER doctor is going to assess, and they call it a level 2 trauma activation. All red boxes will get what's called a level 1. They're calling everybody. If you call in red box trauma, everybody's coming. If it's yellow box, most trauma centers will do a level 2, where they'll notify the trauma team they have a trauma activation, but they'll keep working on whatever they're working on, or if they're at home, they'll keep watching their TV show until the doctor calls back and says, all right, we need to activate it. Any questions? Let's see what you guys have learned before you go to break. You've been dispatched to a traffic collision. What do you do first? PSI scene safe. PSI is on, CHP if the traffic, the scene secured. Your mechanism injury is a minivan that rendered a flatbed 18-wheeler. You have 1 patient. What comes after scene size up? Primary assessment. Patient is unresponsive, elderly male sitting in the driver's seat. Does not respond to verbal or painful stimuli. What's his Glasgow Coma scale? 3. He's got bloody secretion in his airways, so you suction immediately. His respirations are 4 breaths a minute. Do we need to bag that? Absolutely. And he does not have a radial pulse, but he has a weak, rapid carotid pulse, but you don't see any external bleeding. His kids' eyes are pale, cool, and wet. Is he a priority patient? Is he a trauma patient? You red box or yellow box? What? Yellow box or red box? Why? GCS less than 13. And his respirations are less than 10. And he's got no radial pulse, so you know his systolic blood pressure is less than 80. He's got all kinds of, he's got an open wound to the head. So he's got like 4 qualifiers. He only needs 1. What's next? History. Nobody knows him and he's not talking. What's next? All right, blood pressure is 94/40, pulse rate's 132, respirations of 4 being assisted at 12. His eyes do not open. Oh, his Glasgow's not 3. He mumbles sounds and he withdraws from pain. What is his GCS? Don't guess. Add it up. How many does he get for eyes?
4.
1. How many does he get for voice? 2. What's 1 plus 2? How many does he get for motor? Withdraws from pain. 4. What's 3 plus 4? What's his Glasgow Coma scale? There you go, see? He's got an open head laceration, he's got crepitus to the left side of his chest, but the lungs are clinical bilateral, that's good. He's got a firm, slightly distended abdomen, his pelvis is stable. He's got deformity to his left forearm. Second set of vital signs, blood pressure 90/42, pulse 132, respirations are 8. He's improving with you keeping his airway open and giving him oxygen. What's next?
Reassessment?
Get him to the trauma center. Any questions? This guy actually walked out of the hospital. All right, let's do some quick test questions. Your patient's under strain driver is Subaru Brat hit a tree. Complains of chest and abdominal pain. Is very restless, slightly confused, pale, cool, moist. BP 132/78, pulse rate 116, respiration 20. What is she most likely experiencing? Is it A, decompensated shock? Is that decompensated shock? No. How about compensated shock? Better answer than A? How about psychogenic shock? Better answer than B? No. Irreversible shock. This is pretty easy. All right, blood trauma of the abdomen, 21-year-old female's left upper quadrant pain referred to the left shoulder. Ooh, anybody know what that means? What's that? Wow, impressive knowledge, impressive retention. How many years since? 10 years? Wow, pretty impressive. Yeah, that's going to be a spleen. Any questions? No critical thinking there. You have blunt trauma to the left upper quadrant pain, penetrate or radiate in the left shoulder. It's going to be a spleen. 52, and there will be test questions like that. 52-year-old unrestrained female hit the steering wheel with her face. Ooh. Swelling to her face, dislodged teeth, minimal bleeding, blood pressure 130/80, heart rate's 110, heart 20. You're not doing too bad. Should you assist her ventilations? The respiratory at 22? No. Fully immobilize your spine, attempt to locate the dislodged teeth. Put the board on the left side transfer. Better answer than A? Yeah. Apply oxygen, suction as needed. Disregard the dislodged teeth. That's not a good answer. B is still the best answer. Apply supplemental oxygen, immobilize your spine, attempt to locate the dislodged teeth. Suction is needed and transport. Is that a better answer than B? All right, go to break. Be back at 8 o'clock, ready to go into teams. Go to 8:05. I'll catch you guys a break.